Okay, hi, my name is Abby Humphreys, and this is my progress presentation on equine colic. So the purpose of this final report will be to conduct research on the topic of equine colic and the issues that it can cause in the equine world, to provide anyone in the equine community with further knowledge on the sickness, some preventatives, some signs, causes, treatments. Yeah. So the audience for this final report will be any member of the equine community who have had or who have interest in gaining knowledge on colic as a whole, gaining knowledge on the first signs of colic, and gaining knowledge on how to prevent colic. So overview of what equine colic is. In general, it is abdominal pain in a horse. However, most horse owners refer to colic nowadays as any sort of problem in the gastrointestinal tract. There are three types of colic: gas colic, incarceration colic, and impaction colic. Gas colic is the most common type and the most simple. It is simply excess gas buildup in the gastrointestinal tract of a horse causing mild to moderate discomfort. It can be resolved easily with a use of medication, and the prognosis for gas colic is pretty positive. Secondly, impaction colic, which is a little bit more severe than gas colic. It is full or partial blockage of the digestive tract, more specifically the large colon. It can be caused by worms, types of coarse feed stuff, dehydration of the horse, or accumulation of foreign material in the gastrointestinal tract. Large colon impactions make up as much as 8 to 10% of all colic reported. The cause in a large majority of these cases is not known. In nearly 30% of all equine colic cases who are referred to hospitals by their veterinarian are caused by impaction. The most severe and most deadly type of colic is incarceration colic. This is actually when the intestine forms a loop that is not supposed to be there and then gets stuck in the body cavity of a horse. It may require human intervention such as surgery, and most likely will need surgery if the blood supply is cut off. So next, my findings of my secondary research: come up with the causes of colic, signs and symptoms of equine colic ranging anywhere from mild, moderate to severe, treatment options and prevention methods. Some causes of colic range anywhere from high grain-based diets or low forage-based diets, moldy, tainted feed, an abrupt change in feed, parasite infestation or infection, lack of water consumption is a leading cause to impaction colic, sand ingestion, stress, or dental problems. Some signs of colic ranging anywhere from mild to severe could be depression, not interested in eating, pawing, looking at the flank, which is the horse's abdomen, lying down more than usual or at a different time than normal, lying down, getting up, circling, laying down again repeatedly, curling, lifting the upper lip, kicking at the abdomen with the horse's hind legs, rolling onto their back, stretching out. They'll sometimes sit like a dog, groaning, excessive sweating, an increased heart rate, visible abdominal distension, which is the appearance of the horse being bloated, less than normal to no manure production, diarrhea, and in foals cases, they may roll onto their backs, grind their teeth excessively, and salivate excessively. So treatment options for colic, many cases thankfully can be treated successfully with medication. Sadly, on cases that are more severe, they may end up needing human intervention, which can lead to surgery or hospitalization. If you see a horse presenting with any signs of colic, rest them as much as possible, unless the horse is laying down or rolling excessively. It is then recommended to hand walk your horse for prevention of further injuring themselves. As soon as you see any signs of colic, call a veterinarian immediately, and they will help you to decide the next course of action or what medication to administer. Some prevention methods: feed horse on a set schedule. Do not make any sudden changes to their diet. Provide clean, fresh water on a daily basis. Keep their food trays and their hay racks free of mold, dust, and dirt. Frequent teeth checks are important for dental problems, as this could influence the horse's ability to chew their feed. Provide them with adequate exercise in order to keep them in shape. Feed appropriate amount of forage, and practice an effective parasite control program. So for my completed work, I have completed my preliminary research, most of my secondary research, and I have successfully interviewed the owner of a horse who has colicked in the past. What's next? To interview a horse trainer of a barn who has experienced multiple colic episodes in their career. I need to finish up my secondary research and to continue to finish the student suggestions. And these are my references.